Imagine a world where no one dies making a living.
I imagine a world without occupational disease.
Where everyone goes home at least as healthy as when they came to work.
It's important to address occupational disease, which really meaning people getting sick at work. It's because every year more than 2 million people die from work-related diseases. Another 160 million get sick.
This has an effect on the world economy that's enormous.
Work is connected to everything we do, so much so that communities, family, children are all affected.
The children who have been involved and who live close to the workplaces where their parents work, they are affected. So it is not something that only the workers are affected by, it is something that affects the entire communities, entire families.
In Nigeria, hundreds of children have died from lead poisoning as a result of exposure when gold mining contaminants are affecting living areas.
In India, we have children who are developing significant silica exposures as a result of grinding agate.
We believe in the prevention of disease rather than waiting for the disease to occur and then curing it. Only 11 countries in the world have certification programs for occupational hygiene. There is a need for occupational hygiene. That was the impetus to get together and create Workplace Health Without Borders.
Workplace Health Without Borders was formed to share the knowledge around the world that will help us make sure that people know how to assess the hazards that they're exposed to and control them so that nobody needs to get sick.
Primarily what we're interested in is transferring knowledge.
Our projects include training and mentoring of new occupational hygienists, helping to assess and control hazardous exposures in work sites in various countries.
I'm mentoring a toxicology professor in a university in Uruguay.
We're educating physicians from India to increase their knowledge about occupational diseases.
In Nigeria, we're helping to provide the first program ever in that nation of a degree in occupational health and safety.
We're helping a group in Pakistan to assess silica exposures among a group of people working in a brick-making factory. In fact, in many countries, they simply don't have local laboratory facilities to carry out the analysis that's required.
So we have to come up with innovative ways to control exposures and where they can't afford to have electricity or ventilation.
We're trying to encourage our members to think about this, and we're trying to bring in new members who may have strategies, different ways of looking at these problems, and hopefully we can develop new control strategies that are actually workable.
Contact us, tell us what you're interested in doing and what you can offer.
Please join.
Hey, join us. It's a lot of fun.
Please join the growing number of people around the world who are involved in Workplace Health Without Borders in making the world a safer and healthier place to work.